All right, ladies and gentlemen, it's Dr.SammyG in the house. I'm back, baby. I'm back. Now, before we start, there's some people that have been accusing me of reading from a script when I'm talking to you guys in front of a camera. Listen, first of all, those who are accusing me with that type of suspicions, I'm gonna tell you something. You guys look like Seth from Ice Age. Your eyes are deviated from one way and the other way. You guys are talking bullshit, nonsense. Listen, I'm just freestyling in front of the camera. I don't have any script. I don't write shit. I just put the camera on and I talk in front of the phone. And you see this intellectual man who's shining in front of the camera talking all these type of medical stuff. So you should absorb that knowledge. I don't have any script, all right? This is no cheating. This is just pure freestyle. I used to be a rapper once upon a time. I would just freestyle when I was rapping too. So no, stop talking bullshit. I'm just speaking straight facts with freestyles, putting the camera on. I just talk a lot of things I've been taught during my med school years and all these experiences that I have with the patients. So sit down and listen to Dr.SammyG because today's a very different topic, a very significant topic you guys need to think about. Listen, if your face looks like this, if it looks like a tomato, if it looks like you're embarrassed or you're nervous, you got these red rashes around your cheeks, you may have something else than eczema. You see, you might suspect of eczema, you go to the doctor. You take this hydrocortisone cream, apply it on your skin, it gets better from time to time, and then the red rashes comes back, and you become annoyed. You say, man, what is going on? What is going on? And apparently, it's not eczema. It's something else. It might be a completely different story than you were imagining from the beginning. So what is it? Well, this is something called systemic lupus erythematosus. SLE. Remember that name. SLE. All right? So, what's that? What is SLE? What makes you have these tomato-looking faces? And you try to apply some cortisone and it doesn't get any better. Or it gets better, but then it comes back. So here's the thing. SLE is an autoinflammatory disease that is attacking your healthy organs and tissues. So your immune cells, unfortunately, your immune cells are attacking your healthy organs and tissues, ladies and gentlemen. Your body don't recognize what is pathological and what is physiological. It doesn't know shit. So it just sees your healthy organs and tissues and attacks you out of nowhere. All of a sudden, it doesn't know why. It's just attacking you. Why? Well, no one really knows the main etiology. No one really knows the main cause of why this is happening. There are some, of course, contributing factors that can lead to SLE. We have number one, hereditary factors. So genes could play a significant role when it comes to SLE. And then we have some hormonal changes. And these hormonal changes are some contributing factors that can result to developing SLE. Now these contributing factors, apart from the hormonal changes, are first of all, contraceptive pills. You have sun exposure. So frequently exposing yourself to the sun could result in SLE. Number three, you have smoking. Smoking is bad for you. It is bad for you. Yeah, that's pretty much it. So these are the main contributing factors that can result in SLE, all right? And usually, those who come with SLE are usually women between 15 and 45. This is the typical category of patients that are dealing with this diagnosis. But anyways, so what about the symptoms? What are you expressing as someone who has been dealing with SLE? Well, first of all, man, you got these rashes on your face, man. That rashes that make you look like a tomato. The butterfly rashes, that's what they call it. The butterfly rashes, just because it looks like a butterfly on your face, that rashes, that's the main reason why they call it butterfly rashes. So the reason for that is because your immune cells are attacking your skin cells, causing these inflammatory expressions on your face, resulting to these type of rashes. Now, most people who have SLE is also very sensitive to the sun. So when they are exposing themselves to the sun, what happens is that it exacerbates the rashes on your face and your skin, causing more rashes on your face and more butterfly rashes. Now keep in mind that since it's called systemic lupus erythematosus, that means you can also have other organs being affected, not just the skin. For example, you got the joints. You can have joint pains when you have SLE. Even you can have something called pleuritis or pericarditis, meaning that the membrane surrounding the lungs can be infected as well, causing a pleuritis, or not infected, but it can be inflamed due to SLE. And then also pericarditis, that means the sac that is surrounding the heart could also be inflamed due to SLE, resulting in pericarditis. Aside from that, the kidney can also be affected. You can have some kidney problems. You can have blood and urine. You can also have a leakage of proteins from your blood entering the urine, causing proteinuria. In other words, proteinuria, which pretty much means that you have an increased concentration of protein in the urine. And even the blood system can be affected. You can have a problem in the blood system where you can have low level of white blood cells, low level of platelets or thrombocytes, and even something called a hemolytic anemia. So pretty much different organs can be affected by SLE, but the main organ that is usually expressed or like a key factor when it comes to SLE is the butterfly rashes, the skin in other words. Now, when I, as a family doctor, notice these symptoms and I get suspected that you might have SLE, what I do, I just come to the rheumatologist. We can take some inflammatory tests as well, but usually when we have these symptoms that are suspecting us to think that this could be SLE, we are sending you to a rheumatologist to take care of the rest. They take some further tests, further investigations, further examinations, and then if it's indicated, you get some treatments. So if you have that typical facial rash, that butterfly rash that makes you look like a tomato, or someone being very nervous, that these cheeks are having an increased level of rashes around the cheeks, and you use cortisone cream, it doesn't get better, make sure, come to Dr.SammyG, and we'll take some more tests, and it might be an indication that you might have systemic lupus erythematosus. So ladies and gentlemen, that was it. That was the video from Dr.SammyG from today. I hope you guys have a great day, and I'll be back with a new video. Peace out.